Okay.
Yeah.
So just introduce yourself.
Okay, I'm Chermaine Kwant. I'm from the Netherlands, and I'm a researcher at the Amsterdam Group.
Right. Okay. So you're from Amsterdam.
No, I'm from The Hague.
Oh, from The Hague.
Yes.
Right. Is that posher than Amsterdam?
Is
Is it posh?
No.
No. No.
And I know over the last few years we've thought a lot about exercise and encouraging people to exercise. And of course, we all know that we should be eating healthily. And of course, at the restaurant, we're all sitting there wondering what we should be eating, you know, trying to put on a good show. But, you know, how do we eat healthily and how does your diet affect your health? And that's one of the big questions that, you know, Cher's research is trying to
Cher,
answer.
you're a nutritionist by trade, aren't you?
Yeah.
Can you tell me what is a nutritionist? What does that actually mean? Is that different from a dietitian or a
Yeah, I'm a dietitian. So
Okay.
what the difference is between a nutritionist and a dietitian is that you are medical when you are a dietitian.
Okay.
So you can advise people who have the disease on their nutritional habits. So that is different from a nutritionist.
Okay. David, can I come back to you then? Because we talk about nutrition and it's not something we have touched upon in pulmonary hypertension. I think in the UK, nutrition is a lot of confusion about. There's lots of talk in the media about good diet, bad diets. What do you think we're talking about in nutrition? What would some of the work we're going to do with Cher and this sort of thing is, as you said, it's a bit like the physio, is to try and make people more aware and give resources. But what do you think we're talking about in?
Well, I think for all of us, I mean, I'm thinking about myself, I'm thinking about people affected by pulmonary hypertension. I think what you want to do is you want to make the right choices for yourself. And I think for all of us, it's good to feel empowered in terms of what we do. And I think food, we've all got different types of relationships with food. We enjoy food. It's a very, very social interaction. Of course, sometimes we eat too much and we eat all the wrong things. But what are the right and what are the wrong things? And, you know, how can we individualize what we eat for our own benefit? And for example, we know that exercise is something that's good for people generally. We know in pulmonary hypertension that doing exercise improves outcomes. So what can we do with nutrition? And that's what really excited me about some of the work that Cher was talking about is, you know, are there simple modifications that we can do ourselves that make us feel better about ourselves that can also help an underlying medical condition? And I think there's not a huge amount of information out there. And I know, and people in clinic who've got significant disease, and Cher talked about having a transplant, that to be transplantable as well, you have to have your weight at a particular type of target. And I guess that's really just been our focus, has often been for people who are candidates for transplant, getting them to transplant, you know, trying to get their weight down if they're a little bit heavier than is ideal. And I was thinking that's a very small, narrow focus, so that is there not more, and can we not do and give advice and empower people to take care of their own nutritional needs in something that's more beneficial than just reducing, you know, losing weight? Can you actually feel better if you actually have a better diet? So that's what really excites me, Cher, about the work you were doing.
David touched on something really important, didn't he? Because this, I think we do generally in our society think about diet and stuff like that, about weight management, but it's much more than that, isn't it? So you're the expert as a nutritionist. What is nutritionalist sort of selling point? It's more than just weight management. So what is it?
Yeah, I think the most important thing is to improve quality of life with nutrition. So that is my main focus. And when your body will get in sync and you eat the right food, then if you have to lose weight, you will lose weight eventually.
Okay. How does just, I want you to really challenge on what you just said. It's about improving your quality of life. How, if you change your diet, does that improve your quality of life? You've done it. So what does that actually mean? You said in sync. What do you mean?
Well, do you want to know my perspective as a patient or as a researcher? Because
let's go for the patient first.
Patient.
And then,
Okay,
because you might confuse with the researcher. So
those are two different persons, the researcher and the patient. But what I learned as a patient was that when I eat more healthy, then I felt more energetic during the day, and I could complete more daily tasks. Yeah. Instead of when I eat unhealthy, then I felt fatigue for over a week. So I really had to recover from my bad nutritional habits. So that is what I learned. And I think the body is in sync when you have the right nutrients at the right time that will fit you. So personalized diet is very important also.
So what do you, I know you said you were very broad there, David, that we want to know what people's habits are. Do you think there's anything about, are drugs more effective if we eat better? Or is that, as a doctor, do you think there's your diet is really important to make sure that everything else you do works well.
Well, I guess that you could look at it at different levels, Iain, that you could say, well, if you're generally in better shape, then you would expect the drugs potentially to have more of a beneficial effect. So if you've got lots of other problems that limit you what you're able to do, so if you were overweight, there's lots of reasons that we can all be overweight at different times in our lives, then obviously you're able to do less, and then so the benefit of giving a drug is probably likely to be less in terms of the improvement you'll see in your ability to exercise, because you won't fulfill your potential. So if you can get yourself, I guess, optimal in the best way that you can, then you'd think at that sort of time point, then taking a drug may likely to have more beneficial effects in terms of, you don't have other things limiting you in terms of your, for example, exercise capacity. I think as well in terms of interactions, some drugs, you have to be very careful with the foods that you eat. From the pulmonary hypertension drugs point of view, it's not really, I don't think, a major sort of issue. There are drugs like anticoagulants with drugs like warfarin. You have to be sometimes careful in terms of your diet and vegetables. But by and large, certainly my understanding is that, the drugs that you're taking for the management of pulmonary hypertension don't interact with a whole lot of different drugs. So
David, as we sort of just draw this part of the start of this work together, I think it's quite exciting because we've never addressed this area. I don't call it an issue because that sounds sort of negative. We've never addressed this area properly before, so we're going to do. What do you think are the key messages in the next sort of maybe 12 to 18 months, 2 years from this work? What do you want to find out? I know you've mentioned those things, but just recap on what you just said, why it's important.
I mean, for me, I guess I like the idea of having something additional that we can offer to people affected by pulmonary hypertension that makes them feel better about themselves and allows them to do more and enjoy a better quality of life. And I think nutrition is something we do every day. I'm sure we can do it better, and I'm sure we can reap the rewards of that. The challenge is going to be, how do we start understanding a little bit more about it and then thinking about how can we change things? And that's why I guess over to share very much, how do we take the next steps, because coming together is really important, isn't it, to discuss nutrition. So we're really excited about it, but that's why we need researchers like yourself to be able to deliver, provide the evidence, and also provide the information and support to people affected by pulmonary hypertension.
So what's your key message? What in this sort of relationship we're going to start in the next sort of period of time, what excites you the most, and why is it, just again from a patient perspective rather than your research, why is it really important now than it wasn't 15 years ago?
15 years ago, it was all about survival when you were a patient, but nowadays we have way better treatment, much more medication, so the life expectancy is way higher. So quality of life becomes more and more important. And I think nutrition plays a very big role in quality of life. And as a researcher, I'm very excited because it's a whole new field to discover. And we did a small study in the Netherlands with very promising outcomes, and hopefully we can do the same in the UK.
Good. Yeah. And I know, from my perspective, we as an organisation over the last 3 to 4 years have had an increasing interest from members and family about things like diet and nutrition and well-beingness. And I think it's because of the very things that you're talking about, that thankfully we are moving on from just an exclusive survival mode to quality of life and those sorts of things. I think one of the things that the benefit of exercise and nutrition is it's an ability to take back control of things that have been lost. So we as an organisation are really excited about it. So I'm hoping that maybe in 12 months' time we can be sat here saying these are our first findings, and we're waiting for an invite to Amsterdam. We'll do that. We're doing that so we can sample your culinary delights as well. But I think it's a collaborative piece of work and genuinely excited by it. So thank you.